Hi, I'm Catherine Evans, and I believe that in the NHS in Wales we should be aiming for the same common goal of zero harm. It may sound ambitious and unrealistic, but I'm going to explain how my experiences in the pandemic led me to believe that this is possible. It all started on March the 2nd, 2020, when I drove to my first day of work at Hywel Dda Health Board, feeling nervous and excited for the next chapter of my career. I was going to be the head of transformation and responsible for programme managing a team to deliver on the Health Board's strategy, which has a clear focus on population health and care closer to home. A key part of the role would be to develop the detail around what services should look like in the future and plan how we would get there. This would involve bringing busy clinicians, care professionals, business partners and technology experts together to shape and define what that could look like. I knew through my previous role that it would take a lot of time and detailed planning to get these individuals together. However, the final output of having something co-designed with these individuals would be definitely worth it. However, when I was thinking of my new role in the car, I was also listening to the radio. The presenter was talking about the spread of the coronavirus to Italy and the upsetting scenes in and around the main hospitals. They were also referring to how China were able to build their hospitals so quickly to help deal with the virus. Little did I know at that time that I would be responsible for managing the team that would build 8 field hospitals in 4 weeks, doubling our bed base as a health board. As I reflect on those early weeks of the pandemic, I believe that there were 3 key factors that made it possible for us to achieve what we did. These were a common purpose, a clear care model shaped by clinicians and set in the context of our resources, and a comprehensive programme management approach. So the first factor was a common purpose. We had a common purpose of protecting the public at its heart, and we all worked to minimise harm for our patients and the population as a whole. Urgency brought teams and partner organisations together to discuss how our assets and resources could combine to achieve this goal. With the team's focus on building field hospitals, I felt good that despite the long work hours, we had achieved something aligned to the aim of protecting the public, and my team said that they felt good working on something which had a direct impact on patients. The second factor was a clear care model for the field hospitals, which was shaped by clinicians and informed by the resources we had to hand. During those early months, we were able to convene clinicians across primary, community and secondary care to design and agree on the clinical model that we wanted to work towards for our field hospitals. I was able to learn quickly from their knowledge and experience and apply that to our upfront design. This helped us to have clarity around how patients would access the beds in the field hospitals and the care that would be provided there. Even in the face of intense public pressure, it felt good that we were working on something that our clinical colleagues said would help them over the months ahead. Usually, this scale of clinical and partner involvement would take months to arrange. However, the speed at which we were able to have some of their protected time meant that we had a clear model which we were able to really drive at pace towards. The third factor was the comprehensive programme management approach. By focusing on designing field hospitals for one county initially, gave us the time and focus to agree standards and the specifications. We were able to roll the design out at pace to the other counties and indeed Wales. This was achieved through regular check-ins with stakeholders through daily huddles. I remember several debates that happened in those sessions. They ranged from a debate on who could access and refer patients into beds, how patients should flow and move within the hospitals, and whether food should be provided for staff and patients. The time pressure and delivery expectations meant that we had frank and open conversations which resulted in timely decisions and actions. We also had regular catch-ups as a programme team, which enabled us to support one another on both a personal and professional level. The pandemic provided us with a common purpose and showed us all what we could collectively achieve as a care system in the face of adversity through co-designing our care models and delivering it at pace. However, 2 years later, have we leaned into this organisational learning? I feel that we are floundering. We have increasing demand and complexity with decreasing resources. We are being pressed to deliver on a number of priorities and goals without the time and space to be able to take a step back and do this in the most effective way, which places people and our communities at the heart. I feel that our purpose is multifaceted and unclear. I believe we need to once again align behind a simple vision. I think that this should be zero harm. This would give every service across the NHS a simple and ambitious goal to work towards and could inspire each team to proactively make changes and move towards it. Imagine if we as teams could regularly come together to support one another on each other's goals, all with the ultimate purpose of zero harm. We could have a chance to discuss and action improvements, be efficient and productive in achieving our goals. I've worked in systems previously where co-designing a care model with zero harm at its core is absolutely possible and achievable. The model could be co-developed by our clinicians to meet our patient and population needs within the parameters of our finite resources and with injected hope from what technical innovation can bring. I believe this could put us in a better shape for the future. We had the focus set for us in COVID, and it enabled us to transform services at pace to try and minimise harm for our population. We have the chance to set our own goal now post-COVID, which could make a difference to the lives of our families and our communities. And could that purpose be zero harm? Thank you.